To RSI Help YouTube. Today we have a very special guest, Dr. Robert Markison. He's a hand surgeon from San Francisco. He's a clinical professor of surgery at the University of California, San Francisco, and he's had 40 years of experience with the hand. Today he's going to tell us about a very interesting and timely connection between COVID-19 and repetitive strain injury. So welcome back to the show, Dr. Markison. Please tell us what you've been observing.
Well, I've been, obviously I've seen some horrors in ICUs in San Francisco of people who just didn't make it out. And so you have to really start thinking about COVID not as a threat that keeps you up worried at night, but you have to consider how to be at your best in terms of adaptive immunity. The two elements are personal adaptive immunity and then herd immunity. You can't push the whole herd, but you can help yourself. And so just in terms of health maintenance amid risk of COVID, I believe that masks, even if they're not those N95s, can be helpful. But as you use a mask, if you have to work with a mask all day, then it can cause hypoxia and desaturation, measurable desaturation. If you use a pulse oximeter on a finger, you can desaturate with sustained mask use. So be careful about it. Because you don't want to be running hypoxic, because all the tissues, including those that are strained repetitively, need oxygen. They really scarf it up. For my part, which may seem like an old man in a nursing home, but I'm proud of it, I just use a portable oxygen concentrator. And so what that means is that I've got pulsed oxygen under my mask.
Wow.
Right. So that just means there we are. So I can kind of set this and give myself 22 ml of 93 to 96% oxygen, or 55 ml up through a scale, whatever I need. So I never run hypoxic as measured with a digital pulse oximeter. I like to be saturated 97, 98, 99%. That seems a little obsessive compulsive, but I don't regret it. So portable oxygen concentrator, they can be a little spendy, but there are a lot of sales currently because they're coming into increased use. Also, apropos self-preservation and protection, anybody who snores, whether they have to get a polysomnography formal sleep lab study or not, should be considering CPAP and talk to their doctor about CPAP, continuous positive airway pressure. Because that'll keep your airways open. You just use the little nasal thing, only nasal pillows. If you're a nose breather, if you're a mouth breather, need a little bigger mask. But CPAP goes a long way. And what they've found in studies that far predated COVID is that, first of all, COVID is about a cytokine storm that can kill you. What are cytokines? Well, they're inflammatory mediators elaborated by cells that turn on too fast, too hard, too long, and shed all this inflammation into all tissues. And so the opportunistic pathways, the sinuses, although the sinuses don't get involved, then the big enchilada is the lungs. You spread them out, you've got a huge surface area. Those are the vulnerable members. And so if your lungs are closing down a little bit within snoring, sleep apnea, hypopnea events during sleep, then you're in a drizzle of cytokines all day, way before the pandemic. So if you don't want the drizzle to become a storm, because the more the lungs collapse, atelectasis, microatelectasis, the more stormy it gets, goes from a drizzle to a shower and then a deadly storm. Keep those lungs fresh and open. You don't have to swim the English Channel. You don't have to run a marathon. You take a nice walk or a nice dip without straining yourself, and keep those lungs fresh. But during sleep, if you're snoring based on a bed partner telling you so, or whatever you know, waking up with air hunger, get into a little CPAP. It's going to protect you tremendously. Now, go ahead.
What about yogic breathing? Some of the breathing practices, you inhale 8, you exhale 16, or you inhale 2. It's 2-to-1 breathing. So you're really taking a deep breath and then you're slowly pushing. There's also yoga practices that sort of expel the air from the bottom of the lungs out, there's twisting practices that you can do with the breath. Do you think those are helpful?
I think they're tremendously helpful, absolutely essential. Great to expand the lungs, sit up, don't slouch, proper posture, the stuff you've been talking about appropriately for decades. And taking a nice walk, again, it doesn't have to be a run. People are overdoing the physical exercise and hurting themselves that way, but that's important. You brought up a great point. Yes, breathing, extremely important. As a wind instrument player, I like my highest resistance wind instruments, and rather than a flute where you just blow it all out without positive airway pressure. If you're playing reed instruments, a little trumpet or whatever it is.
What about a harmonica?
Harmonica is not resistance. It can be helpful to expand the lungs, but a little bit of positive airway pressure goes a long way. Harmonica's not bad, but again, I like a little resistance. I don't have CPAP going all day, but here's what I'm talking about. CPAP machines, if necessary, have become wonderful, and they automatically synchronize with your breathing, and you will find, again, the compliance can be an issue, and it's a little odd to have a mask on at night. But my many patients up into their 80s and 90s who were previously CPAP non-compliant now are CPAP compliant, and they're breezing their way through a light case of COVID that didn't get worse. Now, as far as repetitive strain injury, yes, of course, it can get worse if you are hypoxic, even a mild case. So you're going to have to back off on typing and other hypermetabolic oxygen consuming activities.
And what's the level that you considered hypoxia? What's the saturation?
Well, you want to be above 95% oxygen saturation. I mean, people can tolerate going below 90, but I've seen patients who desaturate. And so if they're in the office and they're not infectious and they've already passed COVID and they're now positive antibodies, and so they're pretty immune for the future. But I'll just put a little oxygen. Okay, so just check that out as they wear a mask and they keep chatting and see if they desaturate. And so you don't want to desaturate when you're doing repetitive activity. The whole body works on oxygen and microcirculation.
So from what I hear you say, it sounds like it's not a good idea to wear a mask all day. And I'm thinking of these people who are going back into offices and they're wearing their masks and maybe getting a little desaturated. So maybe it's better to work at home so you can breathe normally without a mask. Is that what I'm hearing?
Yes, and obviously the new workplace is going to be largely remote. It doesn't mean never look at another person and have a face-to-face real conversation, but I think for the interim, this kind of uncertain duration, probably better to be maskless as much as you safely can be.
Okay. Is there anything else you want to tell us about thriving during this pandemic?
Well, yeah, I mean, everybody wants to order out, and I get that, and the convenience and so on, but it's the uncertainty of the foodstuffs that you're getting, and it doesn't mean you have to become Julia Child all of a sudden, but home cooking with plenty of greens, veggies and some fruit, low lectin diet, and lectins are what plants make, so plants won't be eaten. Lectins break down the intercellular junctions between intestinal cells, permitting leakage of inflammatory mediators out of the gut into weak targets like muscles, nerves, brain, and so on. And so low lectin diet, if you're lactose intolerant, respect it. If you can handle some yogurt or other lactose fermented stuff, use it. Avoid any alcohol, no tobacco, no e-cigarettes. These are things, stay well hydrated. These are things that sound like basics, but they make a huge difference. Probiotics with a prebiotic to feed them, probably a good idea. Many good brands out there, don't spend a fortune on it. Synbiotics, S-Y-N biotics are coming in, and those are strain-specific bacteria that help you do everything from stay well to make insulin to make thyroid hormone matched strain by strain with the proper prebiotic in the same capsule. That's kind of the future next step evolution, synbiotics. But take some of that without breaking the bank. Take your vitamin D liquid form, because capsules don't work, gel caps don't work. Take liquid D3, maintain a D3 hydroxy D level of 50 to 80 nanograms per ml in sync with rheumatology literature. Take a B vitamin supplement, and preferably chewable so that it's slowly chewed, better absorbed. Those are things that are important.
And what foods are the lectins in? Is it any fruit, vegetable, or are there
Well, the
specific?
nightshades are a bit notorious because those are tomatoes, potatoes, peppers, and eggplant. And you're talking about plants that have been around for eons. The initial threat to plants was maybe 300 million years ago when insects started to eat them. So they made all these lectins concentrated in skin, concentrated in seeds. So you look up a low lectin content food list on the internet and then just decide to move away from one, gluten, because gluten is a very potent lectin. And a low lectin diet's a low inflammatory diet that'll best maintain gut integrity.
Thank you so much for sharing this knowledge, and I hope you come back soon. I'm sure we'll get questions for you. I have questions for you, but we've already taken so much of your time, and I want to thank you, thank you, thank you for coming on the show, and thank everybody for watching, and please subscribe. And if you have any questions for Dr. Markison or me, you can put it in the comments box, and we will see what we can do about answering it. All right, thank you until next time.
Thank you.